is tuberculosis. This tuberculosis in general we used to call as TB disease, and it has got even another name also. This is known as a Koch disease. And see the another name of the disease is a Koch disease. Tuberculosis. In simple terms, we used to call it as even the TB also. And this is caused by a bacteria known as here Mycobacterium tuberculosis is the name of a bacteria, causative organism or the pathogen of this disease. And this disease is get transmitted by the various means. Let us see here what are the means. It is get transmitted by droplet infection. Just now I said here, the person when he is suffering from this tuberculosis, when he speaks or when he sneezes or when he blow his nose or when he cough, there is a droplets of saliva, it comes out. And these droplets of saliva consist of this disease causing pathogen. When the droplets are fall on the another healthy person, then definitely here he may get a chances of this tuberculosis. Is one mode of your transmission. Then another mode of transmission you can see here by using the contaminated food and water. If at all the food and water is get contaminated by this pathogen, then this is used by any other healthy person, definitely the disease causing pathogen it transfers. It is another important here, the mode of transmission. And one more thing, that tuberculosis even it may occur in a cow. The cow that is suffering from a tuberculosis, and if you use the milk of the concerned cow, then this disease causing pathogens are present in the milk of that one. When you consume such a kind of milk, then this definitely get transferred to a person. So this is a one more here thing. The milk that is here taken from the cow which is suffering from this tuberculosis. So this is a one more here mode of transmission. These three are the different modes we can happen to see how this pathogen is get transmitted. There. Then what is the incubation period of this one? After invention of the pathogen, it takes near about 3 to 6 weeks of span of time for the manifestation or appearance of a disease. Or symptoms will be clearly appears after 3 to 6 weeks span of time. So that the incubation period of this disease is 3 to 6 weeks. Then when you see the symptoms of the disease, when the person is suffering from the tuberculosis, he do exhibit variety of here the symptoms. Let us see one by one in a detailed way. So person suffering from this here tuberculosis will have fever, and thereafter the cough, continuous cough. When he cough, generally the blood containing sputum will come out. So when he spit it out, the sputum may consist of the blood. So that is one more thing. See this blood containing sputum. Here is one more important characteristic feature. Thereafter, he doesn't feel any hungry. He failure of appetite. That means he doesn't feel any here hungry. One more important thing. So since this is actually affecting the lungs area, respiratory tract, the chest pain is generally complained by the infected person. Here, the pain of the chest, you can see. And thereafter here, he lose his body weight greatly. Loss of body weight is a one more important symptom of here. Then excessive fatigue. Excessive fatigue. Here the fatigue means tiredness. Great tiredness is felt by the infected person. And next we can see the hoarseness in his voice. In his throat you can see the hoarseness. Since it is attacking and affecting the respiratory tract, so while he is speaking, so you can find out the hoarseness in his voice as well as the throat. So during the night time when he is sleeping, and he will get sweating is one thing, and even the rapid pulse rate also it increases. Pulse rate will be get increased greatly. One is night sweating as well as rapid pulse, or other important here characteristic features of these diseases. So these are all the characteristic features of this disease, and we will see here then what is actually the test that is available to us. A diagnosis test for this tuberculosis is known as Mantoux test. Mantex test, it is available to us. When you go for that, we can confirm the disease from which he is suffering from. So this is one important thing. So let us see here, what is the prevention of this disease? In prevention of the disease here and treatment of the disease, let us see now in this way. The first one is the vaccination is available. It is a prevention. What is the prevention? Prevention is usage of BCG vaccination is exclusively available to us, and that is even exclusively meant for this tuberculosis. This is a preventive method. If you take this vaccination well in advance, it doesn't cause any disease in us. Unfortunately, if you get the disease, then we do here make use of certain kind of antibiotics. Then what is the treatment for this? Let us see the treatment. And using the antibiotics, like see this, streptomycin is one type of antibiotic. Thereafter, see, isoniazid here, isoniazid is one more important antibiotic. Thereafter, rifampicin is one more antibiotic. By using these three types of antibiotics, we can treat the tuberculosis or Koch disease. And thereafter here, there is a treatment method is available to us, which we call it as here DOTS method. DOTS treatment, very important thing. Recently, when you happen to see even some of the TV advertisements also, Amitabh Bachchan is here propagating about this tuberculosis, and he is propagating the information regarding the tuberculosis and make the India free from this tuberculosis. And he is telling about DOTS is a name of a treatment that is available in order to treat this tuberculosis. Then what does it DOTS stands for? Here, directly observation treatment short course is the full form of this DOTS. So it here runs near about 6 months. Directly the patient will be here under the observation of a doctor, and he will give the medication for about 6 months, so that here it can be treated successfully. The type of treatment that is available for this tuberculosis is known as DOTS. So this is all about here the tuberculosis disease and complete information regarding that. Now I would like to give you some of the diseases caused by the bacteria and causative pathogen briefly. See here, the diphtheria is one more here disease. Diphtheria is caused by Corynebacterium diphtheriae is a name of the pathogen that causes. And the next bacterial disease, it includes the whooping cough, or in general we call it as here pertussis is the disease. And this disease is caused by a bacteria known as Bordetella pertussis is a name of a pathogen. And thereafter you can see the tetanus or lockjaw. During this case, actually the muscles present in your jaw and neck or get contract and remain in a contract condition. That is the reason why we call it here as a lockjaw. Your jaws are get locked because of strong contractions of the muscles present in the neck as well as your jaws. And this is caused by actually Clostridium tetani is the name of a bacteria. And coming to here, when you see these three types of diseases, for these three types of diseases, in order to treat, we have a single vaccination. Name of the vaccination is DPT vaccination. Might be hard about this one. DPT vaccination. This DPT vaccination is known as triple antigen. A triple antigen. So since the single vaccination is useful to us in order to prevent the three different types of diseases, that is the reason why the DPT is known as triple antigen. In this DPT, here the D, it stands for diphtheria. The P, it stands for pertussis, which we call it as whooping cough. The reason for the giving this name whooping cough, the patient will get a cough, and at the time of the cough he will get a sound like a oof, oof. That is the reason why the name is given to that, like a whooping cough. And that followed by here spitting the sputum, and the sputum will have a long here string. So that here we call it as a whooping cough, and that is caused by Bordetella pertussis. And next one is tetanus. Here the T, it stands for tetanus or lockjaw. So for these three together, we have a single vaccination known as DPT, which generally used to call as a triple antigen. Just now I explained why we call it as a here triple antigen also. Coming to the next causative organism, when you see here bubonic hair plague, this is otherwise known as Black Death disease also. This is also an endemic disease. People throughout the world get killed by this disease greatly in the earlier days. So here bobo, here kind of here things will get developed within the here armpits. That is the reason why we call it as here a bubonic hair plague, or we call it as here a black disease. And this is caused by a bacteria known as here Yersinia pestis is the name of a pathogen, or it belongs to a bacteria group. And next to this you can see the dysentery is a one more thing. It is otherwise known as shigellosis, and this disease is caused by a bacteria known as here Shigella here dysenteriae is the name of the bacteria caused by here causes this disease like dysentery or shigellosis. And next here causative organism leprosy, and this is otherwise known as Hansen's disease, since the person name is Hansen, who described and discovered the disease named after him as a Hansen's disease, which is caused by a bacteria, and the name of the bacteria is Mycobacterium leprae is the bacteria name that causes this disease. And coming to the next one is botulism. Generally here we call it as food poisoning, and this is caused if the food that you consume is get contaminated with a bacteria known as Clostridium botulinum. Then we call it as here the food poisoning in general. You know, the patient will be here complain with a severe stomach pain, vomitings and motions, and all these things it takes place, swelling of the tongue, and these are all the characteristic features of this disease. And it is caused by this bacteria, and name of this bacteria is Clostridium botulinum, and in general we used to call it as food poisoning, or technically known as a botulism. And coming to here, all these are varieties of the bacterial diseases. So as of now, I explained detailedly about the various common human diseases that are all caused by the bacteria, and the causative organism, incubation period, mode of transmission. So with this I do conclude this topic, that is bacterial diseases. And some more bacterial diseases we do studied more detailedly in a reproductive health topic also. But those bacterial diseases are get transmitted through sexual contact. Under the heading of the sexual here transmitted diseases that are all get transmitted by the bacteria, there also I explained some of the bacterial diseases. And here we do studied some of the bacterial diseases in a detailed way. In the coming session, I do focus on the diseases that caused by the viral infections or viruses. So till that time, you go through all these videos, and hope you all enjoy with this. Thank you.